Welcome back. Today we are talking with Dr. Dean Sherzai. He is the director of the Memory and Aging Center here at the Loma Linda University Medical Center, also a San Bernardino County Commissioner for Healthy Aging. We're talking about aging and age-related diseases. You call this kind of a growing tsunami, that this is something that's going to become more and more prevalent. Explain.
What we are facing is something that we've never faced in the history of mankind. The population is aging at an unprecedented rate. We're talking about a pyramid where just 40 years ago, the majority population were in their 20s and 30s now, and very few were in their 60s and 70s. This whole thing is turning upside down, where a larger and larger percentage of population is 55 and above. With this comes a completely different demographics of diseases, not one that we dealt with just 40 years ago, which was infections and things of that nature. Now we're dealing with chronic diseases, such as heart disease, cancer, stroke, and dementia. And the dementia one is the one that's actually growing faster than all the rest, because although it's not completely related to aging, it is very, very much associated with the aging process.
And it's not just the person that's experiencing it that can have a huge impact on, but also the family, their family, the people who love them, and then are often put in the position of caring for them. You have an event that's actually going to be happening on Wednesday. Tell us a little bit about this.
Sure. This came about after many conversations throughout the county about what's the most important aspect of this approach. And to be honest, we're not approaching it in the full sense of it. If all we did was just dispense pills, we're not doing it any justice. This disease doesn't just affect the patient, it's the caregivers for many years and the family members. In fact, some of the statistics show that loved ones of those who take care of the patients die 60% faster than the patients themselves. Wow. The stress on the family and the structure is just immense. So from that came this conversation about what should we do? What can we do? What are the resources? In a dwindling resource situation that we have, we can't rely on the hospitals and the healthcare system in that sense. We have to bring the community. And there is a lot out there, and we wanted to bring them into the conversation. So on the 28th, we're bringing Director of Public Health for San Bernardino, Director of Aging for San Bernardino and Riverside, several faith-based leaders and other community members to come around the conversation on what can we do to support the loved ones. Right now, when a family member has a problem, they don't know where to go. What should I do? I mean, what if we can bring the faith-based community to help in this? Perfect situation, perfect union, and others as well. So the 28th is, I think, one of the unique events in the country where we're bringing the governmental side, we're bringing the community and faith-based side, and the advocacy from the patient side to converse around this topic and identify, organize, and then move forward towards care for the loved ones and the family members and everybody else, which I think will impact the patients much more than what I do in my clinic. So that's what the plan.
Where's this going to be happening?
This is in Drayson Center in Loma Linda University. Drayson Center is a health center in Loma Linda.
And it's on Wednesday. What time?
From 1 o'clock till 3:30.
Okay, in the afternoon. Is it open to the public, or is this mainly
open to everybody? There's no charge. There's some good, healthy food.
Okay.
And some exercise that they'll be partaking in. And more importantly, they will be part of the conversation.
Okay. Well, good information. Doctor, we appreciate you joining us. Good luck with this event on Wednesday. Obviously, it sounds like there's going to be a growing need for this conversation. So keep up that work.
Thank you so much. And we need help from the community and input from the community.
Something for you to check out if you're interested on Wednesday. Dr. Dean Sherzai, again, the director of the Memory and Aging Center here at the Loma Linda University Medical Center. Top stories are coming up next. You're watching KESQ, the Desert's news leader.
In November, News Channel 3 showed you why the Hispanic vote would be the tipping point for the election. Then shoppers learned why reusable bags like these could be a danger to their health. You saw the return of heroin to our valley streets and the new battle police are fighting. We were the first to expose charges of food stamp fraud at this valley business. And no other team provided more comprehensive election coverage than your trusted source for local news in November and all year long. News Channel